Okay, friends, we're going to get started. Thank you so much for joining us today. A couple of housekeeping things. If you'd like to tweet, please use our handle at Aha Media Group. This webinar was designed for questions and answers, so please feel free as I'm talking to drop those questions into that question and answer chat box. You will receive an access to a recording of this webinar. Feel free to share it and forward it as you'd like. We are going to send you a survey afterward. The most important question to us is other types of content you would like to see during this time period. So please do make suggestions if you have them. I'm going to jump right into it. My name is Ahava Leibtag. I'm the president of Aha Media Group. We've been in the healthcare content space for more than 15 years. We are content strategists, copywriters. We write scripts, infographics, and we do content training. And our mission is to empower people to make the most important decisions of their lives. Now, I cannot imagine a more important thing right now. And I just want to say thank you to all the healthcare communicators who made the time to join the webinar. I know how busy we all are. We're all very slammed. And obviously, we're not on the front lines in terms of actually helping patients and the public, but we are communicating with them. And that's an incredibly privileged place to be in, because we can do so with transparency and empathy. And so let's walk right into what some of the things are that we can do to help people right now. The first thing is to use common sense. So turn off things that don't have to do with what's going on right now. I just got an ad last night on my Instagram for a health system promoting bariatric surgery. I just don't think that's sensitive at this point. People are not looking to buy extra medical things right now. I think that they've also closed all the surgery centers. So it's probably not a good idea to be spending your ad dollars on things like that. You want to be sensitive and you want to show people that you're really paying attention to what they care about. There are things, though, that you can do that relate to the pandemic that also talk about your mission. So, for example, Texas Children's Hospital has a blog about how breastfeeding is really important right now. And UCSF talks about how they just ranked in US News and World Reports. And it's incredible that they say in these unprecedented times, it's more important than ever to inspire and seed the next generation. And that's really true. So they want to publish that content. They're proud of it, but they also link it back to the pandemic. And then Shriners Hospitals here has Happy National Puppy Day. This doesn't really have anything to do with what's going on, except that they say pet therapy helps relieve the stress of medical visits and provides a welcome distraction, which is exactly what people are looking for right now. So if you have content that you want to push out and you can connect it to what's happening, you want to do so in a sensitive manner. So let's walk a little bit through strategy, what we're hearing from clients right now in terms of the things that they're dealing with. So Chris Boyer gave me this metaphor many years ago, and I think it's a really helpful one in today's times. Chris talked about how a cheetah stands on a rock and looks out at the savannah before he or she decides to hunt. And the reason is that a cheetah doesn't have that many sprints a day in it. So it has to choose its prey really carefully. And then once it's decided that it is going to jump, it leaves the rock and it goes to attack. And he said that healthcare communicators never really have a chance to sit on the rock and look out at the landscape and figure out what they need to do. They're just sprinting all the time because they're trying to fight fires. And I'm sure a lot of you right now are thinking that you're in the same position. You are going to burn out really, really fast if you don't take some time to pull back. I'm not talking about a lot of time, but 5 to 7 minutes a day to huddle with your team and figure out what you're doing. So at Aha Media Group, we have a daily huddle every day. We get on Zoom, we go through it alphabetically, and every person is very brief. This is what I did yesterday. This is what I need to get done today. This is where I'm stuck. And the where I'm stuck part is incredibly important, because what that allows to happen is either we solve it together as a group, or the person who's stuck can go to their colleague or to their boss and ask, how do I get myself out of this stuck situation? Particularly because we're all working from home, it's really important to keep those lines of communication open. So even though you're running around and you're trying to get so many things done and you're being slammed at every angle, try to take those 5 to 7 minutes a day to pull back and think through what your strategy needs to be. The second thing I want to talk about is having a laser-like focus on your audience versus the role you play right now. So if you're a large academic medical center and you have a global national footprint, obviously the types of content that you are going to create are going to be very different than a local or regional hospital. But if you are a regional leader or you are somebody who wants to take place on the national stage by producing quality content, that's a strategy and that's important. And there's no reason that you shouldn't do that, but you have to think through your resources really carefully. So I know a lot of you have been pulled into a lot of internal communication as well. So the question you really want to ask yourself is, who is the most important audience to us right now? What do we need to give them? And then maybe worry about the national or regional stage. Some of you may think, no, we really need to be out there in front of this, proving that we're leaders. And that's important for you as well. So just thinking through exactly where you are in this audience versus being out there in the national forefront is incredibly important. If your job is to communicate with your employees and with people coming to the hospital and operational content, then you should be focused on creating the best possible content that can be, even if nobody else in the world ever sees it. Hopkins is a perfect example. They clearly have the relationship with the Bloomberg Public School of Health, and they created this map, which is pulling tons of information from different countries to show exactly how many people have the virus, how many people have died, and the more reassuring number, how many people have recovered. They also, though, have spent their time creating content for people and consumers to answer their questions. So Hopkins has taken the role of, we're a national leader and we're providing data, but we're also providing our consumers important information that they need. For complete transparency, I just want to point out that if you see this star at the top of the slide, this is a client of Ahava Media Group's. Rush is doing a great job on their Facebook page by posting information that's important for their constituency as well as others. A lot of hospitals that we looked at are using their Facebook pages as a way to communicate directly with people by answering questions that people are posting. So don't forget that your social media channels aren't necessarily just a push. You can also get information out there by answering people's questions and using it as an interactive medium. Search engines are using this formula, expertise, authoritativeness, and trustworthiness, to determine if your content is quality and valuable to people. You want to make sure that you're following all the best practices for fighting fake news. Information is coming out every second. Everything is changing. All the markets are in total flux. People are really hungry for up-to-date information. At the end of the webinar, we're going to send out an email with the recording as well as a link to this infographic. Familiarize yourselves with the basics of making sure that your content is reliable and that it is on target in terms of what's going on with the news. We'll also talk about timestamping your content, how to make sure your content comes across as credible to your audience as well a little bit later on. And then the last thing is thinking through your workflow. So it doesn't have to look this pretty, but you want to make sure that you've sketched out workflow for publishing your content. You want to get it up there. It doesn't have to be perfect. We're going to look at some examples that aren't beautifully produced, but the spelling should be right. The content should read real. It should read in your voice and tone. So you want to make sure that you're following your workflow. If your workforce has changed or is down because people are working from home and they need to take care of their kids, just sketch out a workflow that everybody can look at so that everybody knows where they are in the process of creating that content. Now let's dive into some best practices so that you can get some ideas on the things that you might want to do with your own content so that you can create the best possible content at this time period right now. So I've divided best practices into 4 different areas. The first is graphics, layout, and design. So this is a picture of the virus. Almost every hospital website I looked at is using this picture of the virus. This looks like a scary space alien. I really urge you to take this picture down and pick a different picture. There are lots of pictures that you can use that speak directly towards healthcare that are a lot more calming. The American public has seen the pictures of this virus. This virus often shows up as red. It looks scary. When they're coming to a hospital website to get information, they are not looking to be even more freaked out than they already are. So when you have to pick a graphic to use on your web pages or your social media, please consider using a different picture than the one of the virus. Hopkins, again, does a great job at this. They put up this banner on their consumer landing page, what you need to know from Johns Hopkins Medicine, and that's a picture of research. And that immediately communicates hope to people. We're gonna find the cure, we're gonna find the vaccine. That's what we're looking at. We're not gonna put a big red scary picture in the middle of our pages. The Cleveland Clinic is, the best at using graphics and pictures very successfully. This is their Instagram channel. You can see from the mix of the content that they're creating that their voice is focused on their audience and what their audience needs to do to stay safe, to deal with potential systems, to talk to their family members about what's going on, and to deal with their sanity in the middle of a pandemic where you're told to stay home and have social distancing. So they do a really nice job of sending people to the appropriate links that have to do with a wide variety of content that people are looking for right now. Akron Children's does a beautiful, beautiful job of this. Obviously, they're a pediatric hospital, so they have to think of metaphors to use to explain things to kids in a way that makes sense to them. Almost every kid has played red light, green light. So this is a really great way to demonstrate to people social distancing in a way that parents can communicate to their children. So red light is these are the things we can't do, but look, children, there's so many lists under the green light that we can do together. And then obviously the yellow light is something where we have to be careful and slow down. NYU uses graphics and pictures to communicate with their audience using short bursts of information that are important for people to know. So they're giving people information that lets them know what services they're providing and what they look like at this point. So again, the pictures, the graphics, the layout design, we want to think about how do we get that information to people as quickly as possible? How do we use metaphor to explain some of these complicated concepts to people? And how do we make sure that we're not using scary imagery in order to help people understand what they have to do? Now let's talk about authority and trust. And again, we go back to that EAT formula. So the first thing that you can do is you can timestamp your content because again, it's being updated so quickly, and you can also put a stakeholder name or reviewed by your editorial board on it. It's very important right now that people feel confident in the information that they're getting because they're getting such an influx of information. So make sure that you have something on your pages that tells people this was reviewed by somebody and this is when this was published, because if information changes and they come back to your page and that information isn't up to date, at least you've protected yourselves by having a timestamp there until you can get to updating it. Mount Sinai does a really nice job of this. This is a doctor speaking directly to older patients and what they need to know. Again, it's a straightforward video. It's not a lot of graphics and moving pictures. It's just a doctor sitting there, but he looks a little bit older, he speaks very calmly, he's very clear, and he's perfect for the audience that Mount Sinai is obviously addressing in this moment. Michigan Medicine also does a really nice job here. They, again, took a video of their doctors explaining what's going on with COVID-19. Again, not a lot of moving graphics. It's a pretty long video, but it does give a ton of information for people wanting to watch what's happening and to feel confident about what's happening at the regional and national level. Stanford, again, used their doctors and their epidemiologists and infectious disease specialists to talk through what people need to know about COVID-19. They also have this nice graphic that you can download. So they use this landing page of information to disseminate a lot of different types of content that people can use. This is an article from NYP from one of their physicians who's a psychiatrist, and he talks about the different things that you need to do to protect your mental health. So again, having doctors and healthcare practitioners speak is incredibly important towards giving people that authoritativeness and that trustworthiness that they're looking for. And here's a doctor from Nebraska Medicine who writes in the first person a letter that he kind of shares with his family, but then gets published so that other people can read it. So having healthcare practitioners, doctors speak to your audience is incredibly important right now. Time-stamping your content, making sure that you keep a list of the URLs that you are changing so that you can go back and update them if necessary, are really important towards developing that authority and trust with your audience. Now let's talk about my favorite topic always, which is the audience and patient journey. So again, you want to think about two things here. You want to think about how the people are navigating through the information, and layout and design come into play with that. And you also want to think about specific audiences. So let's talk about the patient journey first. UCLA does a nice job of this. Again, many hospitals have created these landing pages where they keep all of their corona and COVID-19 information, and they link out to other pieces of information that are important to people. Here, UCLA does a good job of combining that external and internal information. What if you're a patient or a visitor? What if you're a health staff or provider? What if you're a patient and you need to know more information? So they use these clearly laid out colored boxes to allow you to navigate to what you need to know, depending on who you are. And you can see in the bottom right-hand corner, they have that video that explains COVID in a very basic way to people. They also released a chatbot. So you can go on the website on any page and the chatbot will pop up and will give you information. And you can see here that coronavirus information is one of those options that you can select in case you need information about it. Cleveland Clinic has also done an excellent job of using technology to help people. They have this Start Your Screening Now page that you can go to that asks you about 3 or 4 questions, maybe it's 5, and then you get an answer. So when I took it, I was at medium risk because I was exposed to somebody who tested positive. That was 2 weeks ago, and obviously I've been practicing self-quarantine and social distancing, but I was able to get this information, and I did share this screening with friends because a few of us were around that person, and I was able to tell family members these are the basic questions they're going to ask you before they're going to decide whether or not you need a test and whether or not you want to go to the hospital. Health Partners does a really great job here of communicating with people who need operational content. So there are people who need to go visit a doctor. They have chronic conditions, particularly we've been hearing a lot of scary information about those people with underlying conditions. How do they handle the disease? They do need to see their doctors. What do they do? What do you do if you do have an elective surgery planned? And then at this bottom here with the health and visitors guideline, I love here how it explains that for certain kinds of things where people do have to be in the hospital, like giving birth or unfortunately end of life care, what that looks like for their visitors. Now, this piece of content was grabbed on Thursday. It says for birth center patients, 1 support person. New York Presbyterian, which obviously New York is ground zero, it's one of the major places that we've had an outbreak. They have now said that nobody can be in the room with a woman who's giving birth, not even her partner, her birth partner. So again, this is content that we have to keep up to date with and change as much as and keep on top of as much as possible as things change. Seattle Children's developed a really nice 2-page PDF that explains to people what home isolation looks like. Obviously, some of these children are very, very ill, and catching the virus would be deadly for them, even though we know that young children aren't necessarily as susceptible as adults. So they prepared this handout for patients so that they understand exactly what this looks like and gave them some information on the next page about how to handle it. This is from Women's Health Texas. So again, you're going to have very specific audiences who either have these underlying conditions or who sit in a category where their healthcare needs are ongoing, even though this pandemic is going on around them. And so Women's Health Texas takes advantage of this to explain to pregnant women, obviously that's one of their major audience constituencies, about what they know about COVID-19 and pregnancy right now. So if you have a very specific audience, or you know that within your general healthcare system, you have a larger audience, let's say you treat a lot of heart patients, you want to make sure that you have content that addresses them as well. Creaky Joints does a really nice job of explaining to people who have different kinds of joint problems and arthritis issues about how to take care of themselves. Some of them are immunocompromised, and they also need to know very specifically what kinds of health information will help them at this point. National Gaucher Foundation is a client of ours. They're constituency also has special healthcare needs. They have infusions that they have to go to on a regular basis. They came to us and asked us the easiest way to prepare this information. And so we created this very simple infographic for them. This is the second page of it. It describes how they should handle it based on the fact that they have a diagnosis of Gaucher. And then University of Utah Health is doing a fantastic job with translating content. So again, you might live in an area where you're serving a lot of different populations, and you want to make sure that you have information easily accessible to them. So they have these signs in a lot of different languages, and then they also created videos. Now again, this is a simple video. It's probably done on a nicer camera, but there's no fancy graphics. It just shows an interpreter in that language standing in front of a sign explaining what people need to know. So again, you don't have to spend a ton of money. You don't have to spend a ton of budget. It doesn't need to be the perfect thing. What it needs to do is communicate quality information. And then the fourth thing I want to talk about is mental and behavioral health. For a lot of us, we're going on week 2 or week 3 of this, and obviously people are starting to really get used to a completely new way of dealing with their lives. Shepherd Pratt is a behavioral health hospital system. They created this page for their employees. So this is a really important landing page for their employees in order for them to manage their health needs. This is staying home for. So this is an important thing on social media, that you should be hashtagging some of your content with the hashtags that are appropriate for what's happening. So staying home for is a really nice idea that gives people passion and purpose. We saw on the rush slide of all the healthcare workers holding that sign, I came to work for you, please stay home for me. So do some research, look at the hashtags that are trending, and make sure that you're hashtagging, particularly on Instagram, the posts that you're putting up so that people can see them as they follow particular hashtags. Here's an example of a behavioral health organization that has a conundrum, because Alcoholics Anonymous and other groups like it depend on in-person meetings to maintain their sobriety. So Alcoholics Anonymous created this page to explain to people how to have options for online meetings. Now, they say here that if you don't want to create an online meeting, here's what you do. Again, this content was pulled on Thursday. Today is Monday. It's a completely different world out there. That's how fast it's changed. So again, in order to keep your sanity, you want to maintain a list somewhere where everybody in your group can see it of which content you're touching, because you want to go back and update it if something changes. And Scripps does a really nice job here of talking to kids about coronavirus, depending on the age of the child and what's appropriate to share with them, as well as language around that. So again, having these kind of resources for people is very helpful. You're probably sitting on a lot of this content already. Just do a search on your site for some of these things, and you can probably take content you've already written and repurpose it pretty quickly into an article that focuses on how to deal with coronavirus right now. So to summarize, in the 4 areas that we talked about in terms of graphics, layout, and design, you want to use different graphics than the one of the virus itself. You want to break up your text with graphics and visuals. On those landing pages where people go to find information, don't just dump all the information there. It's not helpful to people. They can't find their way. You can find different ways to separate out the information according to where people might be. So you might want to think about symptoms, you might want to think about staying at home, and link people out to other information that's valuable to them. Use metaphors like that Akron's children, the red light, green light, and provide information that is truly helpful in those short bursts and chunks like NYU Langone did with telling people about the operational information around the hospital itself. For authority and trust, make sure you put a timestamp or something similar on your content. Use an expert voice. So again, it doesn't need to necessarily be a doctor or an epidemiologist. You could have a nurse. You could have another different kind of healthcare worker. You could interview a volunteer if they're still allowed. I don't think they are, but make sure that you're using people who are on the front lines, who really understand what's happening, to really give that content that authority. And again, you want to produce quality content, but it does not have to be perfect as long as the quality of the information is there. In the audience and patient journey section, you want to provide information and context. Like I said before, don't just dump the information, but make the patient journey pretty obvious so that they can self-select which bucket they think they're in. You want to provide information for people in at-risk populations. So along with this recording of the webinar, we actually wrote a pretty long blog post that's very helpful about how to address different kinds of patients with underlying conditions. So please use that as a resource as well if it's important for you. And you want to post updates for visitors and vendors on what's involved in being on campus. And then for mental and behavioral health, explore topics about living with fear and uncertainty, and you want to give people information that can be shared. I just want to touch pretty briefly on search engine optimization. Breaking news, Google launched this website today. This is their coronavirus hub. You can get ideas here of what types of content to produce. You can also go into other information that they have here about health information, safety trips, data, and insights. And you can also use Google Trends to find other information and long tail keywords that you may want to use in order to give people the information that they're looking for. Schema is also really important here. You want to make sure that your back-end code is appropriate for the search engine so that they can grab content off your site that's applicable to what's happening right now. And then you want to think about FAQ pages. So, and this is from Search Engine Land where they talk about this. So the issue is like this. Every page that we write, pretty much like treatments and conditions pages, they're FAQ pages on that particular topic. So if you're writing about heart failure, you're going to say, what is heart failure? What are the symptoms of heart failure? That kind of thing. So to here, you want to write those same kind of frequently asked questions about COVID-19. This is an example from Children's Hospital of Philadelphia, otherwise known as CHOP. They do a really nice job of addressing their audience in these FAQs who are particularly worried about their children. So that is the end of the best practices content available that we found. I hope this is helpful to people. I would love to be able to answer questions now to help give you some insight into what we're seeing in terms of more best practices or other best practices, and to help you during this really difficult time. And I really appreciate you coming and being here. We're all in this together, and as much as we can be helpful, we want to try to share the best practices and communications that we're seeing.
Ahava, we do have some questions coming in.
Okay, great.
The first one is, how often should we be updating our coronavirus content or producing new content relating to COVID-19?
That's a really good question. So if you have something to say and add that's of value, you should be updating and adding more content. So for example, if operational things change in your hospital or your health system or on one of your campuses, you should be updating your channels. If you have blog posts that you think add value at this particular time, you should be sharing them on social media and publishing them. But if you have nothing new to say or add to the conversation that's of value, you probably shouldn't. I do think I would say during this time period, I would update at least 3 or 4 times a week your social media channels, just to make sure that it looks like you're paying attention and you're doing what needs to be done.
Great. The next question that came in, other than web hubs and emails, do you have recommendations for communicating to employees things such as mask usage, work changes, etc.?
Yes, absolutely. So I think signage is incredibly important. I think that there should be signs everywhere. I think that there are regular briefings that are going on in hospitals. I think that you should communicate with the people who are doing those briefings to read those announcements to employees. I don't know if you have your employees on text, but you can certainly do that. If they're opening up their intranet, it should be on the homepage of the intranet before they even can log into Epic or anything like that. So there's a lot of different ways that you can get to them. But the most important thing is that when you're creating this updated content, say in the content, please share this with your colleague. We are doing our best to get this information out. So today, if you see 2 colleagues or you speak to 2 colleagues, please forward this information to them or share it with them verbally. When you ask people to do things, they're much more likely to do them. We assume that people know to do those kind of things. They don't think about it unless specifically asked.
Okay, the next question. Is there anything we should be doing to keep up our marketing strategy for the time being, or should we let it go and revisit it when this is all over?
Oh, that's a really good question. Again, I think it comes back to your resources and what you're capable of doing. If I'm talking about protecting your mental health and what you should be doing, I don't think you should be spending more than half your day on coronavirus if you can. Hopefully this is going to get solved sooner rather than later. Even if it takes all of Q2, you're still going to have Q3 and Q4 where you're going to have to show results. So if you can continue with projects that have already been started, or even start new ones that you know are going to come up at the end of Q2, I would keep doing them. For your own mental health, it's really hard to spend all day on this, but I know that you have bosses and colleagues and direct reports that you have to respond to. So again, that's why I think that daily huddle or that strategy session on the rock is so critical, because I think that if you take the time to think through what really needs to happen, you can carve off a certain amount of time to spend on coronavirus and carve off another amount of time to spend on other things. But again, this is a completely changing situation. The Surgeon General came out today and said this might be the hardest week we've hit yet. So you may have to pivot. And I think that we all just have to live day by day and try to deal with what we've got in front of us at that moment. So to answer the question, it depends. Spend some time thinking about it so that you feel more comfortable with the plan you create.
Okay, do you want to take another question?
Yeah, please.
Okay. Our usual stakeholders are overwhelmed and on the front lines dealing with patients during this crisis. How do you recommend we get quotes or information?
Again, a good question. So I would be careful about how to handle that. I think you can send, so a lot of you already have relationships with some of your stakeholders and your doctors. So I think that you can find ways to communicate with them, to say to them, I need you for 3 minutes just to give a quick quote. You can also try emailing them, although I don't know that they'll respond, to ask them to put something in writing. And you can also ask the people that they work with on a daily basis, like their administrators or their PAs or their, nurse practitioners, to try to get quotes from them. But everybody is scrambling and everybody is really busy. So that is an important thing to remember. Do the best you can. If you can't get something directly from a doctor, just make sure that you can back it up with either a .gov or an association site so that you're not publishing information that could potentially later turn out to be wrong.
Okay, great. We have one more question here. We are a national, oh, okay, another person said skip this question. I think you just answered it. I do have another question that came in too.
Sure.
SEO around coronavirus and COVID-19 is very competitive. Is there anything individual hospitals and health systems can do to stand out?
Yeah, that's a really good point. So definitely look at that Google Trends keyword information. Also look at your Google Webmaster Search Console. So you might have questions being asked that are bringing people to your site that will give you insight into what people are looking for. You're not going to compete with Google. You're not going to compete with, CDC. That's not what you're looking to do. If you are looking to really compete out there and sort of get your feet into the national marketplace and the regional news, you need to be thinking about your own voice. Who are you? Are you advocating for the consumer? Are you a pediatric hospital? Are you a women's hospital? Do you have a huge heart hospital, like I said, and you want to talk about cardiac patients? Pick an angle that you can fit in that serves your business needs and create content around that. The best way to do that, again, is, like I said, base it on data, look at what's coming into the website, look at Google Trends, do some keyword research. And then the other thing I would say is sit down and brainstorm. What are the top 100 questions somebody could have about coronavirus and being pregnant, coronavirus and the 4th trimester of taking care of a newborn, coronavirus and end-of-life care? And make a list of those 100 questions and then start answering them in short blog posts and short social media posts. Alrighty, it looks to me like we've gone a little bit over. If people have any questions, feel free to please email me, Instagram me, tweet me, call me, whatever works. I'm more than happy to answer your questions. Thank you so much for taking the time to be here. We're hoping and praying for the entire nation and the world. And like I said before, we're all in this together. And so as much information sharing that we can do, that helps us all be better at communicating with patients and the general public, please let's share that information. Thank you so much and have a good rest of your day.